Well, hi, this is Lynn, and we're here with Teresa Walding and Isabel Bruce. We're here for our follow-up question and answer session after our webinar last week. And today's the 8th day of November, 2023. Well, our topic always is our series name, which is what is nurse coaching? And we've been talking about conversation and communication. So that's what we'll be talking about today. And Teresa has prepared a beautiful little slideshow for us. So I'd like to go ahead and offer that now. And we may be joined by others as we go along. And you are most welcome to be here today. Thank you so much. Teresa?
Thanks, Martin. Sure. Here, let me share the screen and we will get started. I don't know why I have trouble every time with the start button. There we go. So what is Nurse Coaching Series? And this particular topic is a catalyst for effective communication and teamwork from a principal's perspective. So we wanted to just open this conversation to talk about why principles are even important in a conversation for communication and especially with teamwork. So we want to explore how nurse coaching, guided by the three principles, can transform communication and teamwork and embrace the one topic that everyone is always happy to hear about is separate realities. By understanding separate realities, we really do increase our communication, we increase our teamwork, and we really become more compassionate and in each other's corner when we're having conversations and working together.
So our objective is to understand how nurse coaching with the three principles can enhance communication and teamwork by embracing separate realities. Basically, what it comes down to is when we understand how we work, we will understand how everyone else works. And that's our objective today, to begin to talk about that ease of communication and conversation that can be so benefited by people understanding that I can't have my thoughts, that I can't have your thoughts, and you cannot have my thoughts. We truly do live in separate realities in the way that we experience the world.
And just to kind of set the groundwork, I wanted to go over, many of you have heard us speak before. We know we talk about mind, thought, and consciousness. And I just wanted to reiterate what those principles are. They're really the principles of life. They're how we experience life. They're just the foundation of how we work. So mind is our connection to all of the knowledge that ever was. Some people call it God, spirit, the knowing that the world, how the world works, is all comes from mind. And we have consciousness, which makes human beings are the only ones that are aware that we think, that we can actually observe our thinking. We can make choices based on different scenarios that we can think about. But it really is thought as that piece between our mind and our actual reality that we see, because it's through thought that our reality is brought to life. It's your thought. Some people say it's the most powerful thing in the world. It truly is, because when you have a thought and you take action on it, you have just created your life. And in its simplicity is where we kind of get lost sometimes in our ability to recognize our thinking. We also have an opportunity to make new choices. So nurse coaching and the three principles, we combine our medical expertise and the wisdom of the principles, which we've always used the wisdom of the principles, but when you know that you're using them, it actually helps us to have better conversations and to recognize, as we talked about separate realities, every person thinks differently, responds differently, and acts differently. And that empowers us to recognize these differences and not really judge them as we're speaking to people. Become curious about what they're saying based on their perspective. It helps us to acknowledge each other as an individual and a human being. So nurse coaches, understanding how thought works, really gives us a foundation and a catalyst for change. Because when we drop our criticisms and our internal dialogue and really become present with someone, that active listening without judgment, that ability to truly embrace another person just the way they are and show, that part of us that wants to hear what someone is about and encourage the dialogue. When we do that, we're actually empowering people to express their deeper sense of knowing, their desires, and to actually be heard is one of the most profound things you can do for someone. And when you're open to other people's perspectives, you might actually learn something. That's the part that I love, is really hearing what someone else is saying opens new doors for the listener, which is us. Lynn?
Isn't it neat that we get to be curious? And that is our curiosity, which is going to carry the day. Because when we truly want to understand another person, we have to be curious about their life and how they are seeing things. Even knowing that we won't see things the same way, we have to be curious about how they see it so we can begin to communicate.
And I think it bears saying here that when I heard it said, no one can have your thoughts and you can't ever have theirs. Even though sometimes we think it would be better if they would think like us, it will never happen. It's an impossibility. When I heard that for the first time, it was like, oh, that's true. But there's often times where we are speaking to people and they may nod or agree or respond in ways that tickle our ears and we like to hear it. That doesn't mean that they've actually agreed to what we're saying. They're just wanting to be in the conversation, to support you, to help you with whatever you're talking about. But when we begin to listen at that deeper level, we can actually hear things we haven't heard before. And new questions and new thoughts come from that place. That separate realities, the very first time I ever heard it, really truly heard that we actually live in a separate reality, and no amount of what I think about other people can change anything. I used to think that that was possible just by my sheer willpower, I suppose, of my desire to help someone. But I realized that dropping judgment and criticism of other people for the way they're living life, the way they respond, the way they show up, every time I see different ways that people show up, I now can, in my mind's eye, see, have I done that before? I know a lot of people want to take the high road and think, oh, that's not me. But I think it happens to all of us, unbeknownst to ourselves. And when we realize that that's just the normal way that people interact and respond to people, we can truly drop judgment and self-criticism. And when we do that, all that's left is compassion. From
Well,
that place, we can really touch someone.
just to know that we are um, essentially living our own private lives, and at the same time having an appreciation for someone else's life is really refreshing. I remember we had one student who was working in the emergency room one evening, and they wheeled in a young man, just 25 years old, too morbidly obese to ambulate independently. And he said, I want to make some changes, but I want to talk to the doctor and find out what's possible. And of course, she said, well, the doctor's over there and can't come right now, so let's just have a conversation. And as the conversation unrolled, she, through her own insight, was able to say to him, you know, calories are energy, and you are all fueled up to go in any direction you like. My goodness, he heard that so deeply. And the truth of those words, he just totally wanted to stay in touch with her as a healthcare provider, which of course was not possible in the emergency room. But we don't know when we might have a word to say to someone that can change their life forever. And she had a glimpse into his separate reality that was the inspiration for that insight that came to her to say those words. You are all fueled up and ready to go in any direction you like.
That applies to us too, in every circumstance.
Mm-hmm.
So in this way is how nurse coaches are bridging the gap in communication and teamwork. The active listening, dropping judgment, encouraging that open dialogue, and truly getting curious about another person and what they're saying. And then holding space for their insight. You know, insight is the outcome of coaching. When we have insights into why we would do something or should do something, we are much more likely to follow through, to take action. And it truly is where our wisdom and resilience lie. So when we use the three principles, mind, consciousness, and thought, to cultivate empathy, what we're saying is that these foundational principles are life. It truly is, quote, that simple. I was talking to my sister. I just came back from a trip to Idaho. And I said, listen, she was trying to figure out what the principles were or how to use the principles. We're all using them all the time. It's the operating system that human beings use to live life. And she goes, that's it? There's mind, all knowledge. There's consciousness, and I'm aware of my thinking and everything around me and my environment and what's going on inside of me and my thinking about it. She's like, well, that makes so much more sense. She's like, so it's not like you can really stop doing it or decide that you're not going to be a certain way. I don't think any of us have ever stopped to think, oh, let me pause before I respond. Now we do that when we're aware that this is how the system works. But until you understand how the system works, most of us don't. We just say whatever comes to mind next, or we're already thinking about what our answer will be when someone else is already talking, and we may miss the most important part. So the principles in this way is what enhances teamwork among healthcare professionals, because when we understand this system of life experience, suddenly we can have a lot less on our mind, become interested in what someone else has to say, and then respond accordingly. By doing this, we improve patient outcomes. We reduce the stress of the healthcare provider themselves. Because when you take things off your mind, with a quieter mind, we can get things done more quickly. We have access to maybe new solutions we hadn't thought of before, especially in the light that most of us have repetitive thinking over and over and over. we keep trying to fix problems with the same answers we've had all along. It really doesn't help us when we do it like that.
There was a study done with a large Midwestern medical center using these principles, and they surveyed the physicians that were the clients. And what they found was that there was actually a 64% reduction in ruminative thinking. In other words, thinking the same thing over and over again. And what that led to was much more direct attention being paid to the patients, a faster resolution of the patient's issues, and the physicians found themselves able to complete their work in a more timely manner, arrive home much more quickly, and they loved the institution that they worked for. Those were the findings, with 64% reduction of rumination. They had better sleep also.
The one last one was only, what was it, 30 physicians attended the program, but there was a 12% reduction in stress hospital-wide. That's the effect that we have on each other. You know, if we come stressed out, upset, all the things that we all talk about, our teamwork and collaboration just go downhill from there, you know. So having this ability to really recognize separate realities and become curious and set the stage for honest collaboration and communication, it benefits everyone. It benefits the healthcare worker, and it benefits our patients most. So just as a little summary, acknowledging separate realities, it really is a powerful catalyst for change. And it really is in the experience of becoming aware that this is what's happening with us. We will transform our communications, teamwork, and just enjoy going to work. And we'll become more compassionate and effective healthcare providers. And I would encourage anyone to embrace this idea of separate realities. It really is a metaphor for really understanding life and communication and our health.
Well, thank you, Teresa. Yeah, really, really beautifully done. I love knowing about the separate realities. That's the one thing that people can always connect with. You might tell about when you presented the program at Fort Riley.
So my husband created a reunion for his Desert Storm buddies, and I presented the PDF actually that we have that is the basis for our school, and it talked about separate realities. And he said, as soon as I said separate realities, the colonel stood up and said, now you have the room, tell me about that. Because they were all chuckling. They're like, we know we have separate realities, right? That's not a secret. The difference between understanding separate realities as, yeah, we're individual people, is this idea that we really like people to think like us, or that we somehow have the edge over someone else, like we know more or we know something else. And they were laughing about it because all the people who were in charge were laughing like, yep, that's true. And he told me later, he said, if I could get them to understand this one thing, it would be so much easier to train people. And I thought, well, here you go. I'm here to help.
Yeah. Oh, that is just so beautiful, Teresa. Well, I guess we'll go on into the question and answer session of today. And I should ask first what questions Isabel might have come up with, or just some questions that have been voiced to you by the other people that you've been in contact with. What do people want to know about nurse coaching?
Thanks, Lynn. I think the question that I get the most is how can nurse coaching help with our patient populations in a clinical setting? We're becoming more focused on population health and addressing a broader scope of how our communities affect individual health. And that's where separate realities become a big factor. It's huge. We all, and I know I did for a very long time, just assumed that everyone thought the same way I did. And I didn't realize the impact of how significant it was that we truly do think differently, but that doesn't have to upset our world when we recognize it. So I enjoy hearing the reinforcement of it. I love to hear Teresa talk about the impact that the veterans recognized when she presented to them. It's huge.
Yeah, I think it's one of those things, isn't it, where it's something we say we already know, but there's a deeper level to it. You know, the day I heard separate realities changed my life, not because I didn't know I had a separate reality, but the implication of, oh my goodness, like I don't have to control people. I can have a conversation and recognize they have their own wisdom, their own way of thinking about life. And again, when you listen to what someone else thinks about, whether it be a problem, a decision, life, whatever, they're solving those problems within their own consciousness, with their own knowledge. And when you help people hear themselves speak out loud what they're actually thinking and point to, see, that's how it really works. I was having that conversation with a person, and in one phone call, we were crying, laughing, just regular talking, and went through the whole gamut of emotions. And I said, do you see how thought works? She's like, I've never seen myself do that before. Because the first part of the conversation was, isn't it awful? And hope, what am I going to do? And that kind of thing. And then the subject changed naturally. And she was like, oh, well, I'm going to be fine. Everything's working out. And I watched the whole conversation evolve as she thought for herself about her next steps. And she settled down internally. And at the end, she was laughing. She was like, I can't believe that just happened. But you, in a coaching conversation, you can point that out for someone and they'll know what all of that means for them. And I thought that was a very interesting, and we don't have to do it for them. It's just helping people to see that, the truth of that.
It's really interesting to find where curiosity will take us. I know Keith Blevins is our mentor, and his wife Valda was talking to a woman one time who was mentioned something about her son, and Valda just got very curious, and she said that they had lost him. He had died young, and while they were traveling, they actually encountered a family of 3 daughters who had lost their parents. And when they got back home from their international trip, they were able to adopt those 3 young women, those sisters. And that was how that mother was able to deal with the loss of their son and moved right into loving 3 young women who needed a parent right at that time. It was such a beautiful story, and it was only curiosity that evolved and blossomed into the story that Valda heard that day when she was asking about the woman's son.
Wow.
It's amazing.
I'm curious, Isabel, what have you seen about separate realities for you?
For me, it removes judgment. You know, in the past, if it was not so much, how do you explain this? If it was something that I was having a conversation with someone about a situation or event, and we were on the same page, you could recognize the differences in thinking, but you were in the same direction. If it was a conversation, but we were in different directions, had different perhaps outcomes in mind, I always felt myself judging. Not harshly, not intentionally, but evaluating how their thinking was different. And now recognizing that we all have separate realities, it opens my mind to deeper listening, to a deeper understanding of the other individuals that I am dealing with, and makes me more receptive to other people's ideas. And there's no judgment. It just is what it is. That gives me the option to continue with my line of thinking without judging, or waking up and saying, you know, that person has a different viewpoint that I like better than my own. And so it allows me to change direction with love and understanding.
I love that. Very well said.
Boy, that takes a lot of courage to admit that you like their way of thinking better than your own. That's huge. How often do we get to do that? I mean, we're so focused on ourselves and our own understanding all the time. Wow. I mean, just to be able to take that stance. I'm interested. I'm curious. I want to find out. And then be able to change course completely right in the middle. How amazing is that?
Yeah.
You know, what's funny about that is those could be very tiny conversations.
Mhm.
Like, show me how to do something easier at work. You know, sometimes I'm doing it the hard way,
Oh yeah, all the time.
and someone else comes up and like just, you know, does something like in 2 steps and I take 10 or whatever. And I'm like, why didn't I know that? And one of those was my friend at work. She brought me a patient and they wanted to use the bedpan. And so I just naturally stuck the bedpan, stuck in the suction, and no mess, no cleanup. And she looked at me and she was like, why did I never know that? I've been a nurse for 20 years and I didn't know that. And she, you know, like that light bulb moment. Well, I think what you just talked about, Isabel, is kind of that simple. Seeing something different, doing something the same way over and over and over, because that's supposed to be the way to do it.
Mhm.
You know, now that was a demonstration, but you could see the switch in thinking, like, I'm never going to do it this old way again.
Wow. So that really takes us back to another big communication thing, which we describe as flat earth thinking. Remember how in the good old days, the ships would go sailing and they would take these huge anchors, thinking that they might fall over the edge of the earth. Well, and that they would have the big anchor to weigh them down so that they wouldn't fall off the edge of the earth. Well, when mankind realized that the earth was a globe instead of being flat, some of those big anchor makers went out of business because everybody knew they were not going to fall off the edge of the world. But we've got so much old flat earth thinking in healthcare right now, and this is an incredible opportunity, the perfect time for us to recognize and remedy. I'm not going to say dismiss, that was the word that came first, but we're not going to dismiss the thinking, we're going to remedy it. And that clarity that we now have will be seen to be so much more effective and so much more beneficial not only to ourselves as the healthcare providers, but to our clients and patients as well. There will be no need, no use for the old thinking that has always been around us. And what does it take to see that? It literally just takes seeing it, having the eyes for what is no longer working, having the eyes for seeing what never did work, having the eyes to see that it's our own understanding of how, the way that life works, and it only works one way. It's our life being experienced through our thoughts, and that, in an expression, is how we see life coming out of our eyes. It's the life that we create through our thoughts, not the old way that has always been done, but the new way of understanding how life works. Teresa, you have a better way of saying it than I do.
But it's your thoughts, your feelings coming out your eyes. It's you. And we don't have to judge our thoughts. We don't have to change them even. It's in the recognition that that's what's happening. That little part is what really gives us the edge in everything we do, whether it's communication, living life, making decisions. I like to imagine a world where everyone understands that concept. And what's coming now is, I used to walk into, it's kind of like you go from the quiet and you open the doors and everything is happening. Every time I would walk into the same day surgery, because in front of the doors, it's quiet, everybody's waiting. You open the doors and it's the buzz of everything, right? Starting IVs, going to the OR, whoever's doing what needs to happen to prepare people to go to surgery or to procedures. And one day I would walk in, and because we had the same routine, this nurse would be coming out and she goes, "It's like this every day. I have to wait. Nothing is ever done." She's upset. She's, stomping off into the OR to wait. The next day I would come in and she goes, "Well, they're not ready. I'm going to go get breakfast." Same person, same circumstance, happened every single day. Some version of that happened every single day. And I thought, wouldn't it be fun if everyone knew that there's nothing else to do? You experience what's happening, and in those moments you decide how you're going to respond, and that's the life you get to have. I never knew that for a long time, that your own behavior, which comes through your thoughts, will predict the day that you will have. How would you like to show up?
Wow, that's beautiful. I know, I heard Renee Thompson talk about a woman that she worked with that literally would put on her happy face and walk through the door every day. She was known to be the happiest person in the hospital. And the reality was that there were tragic things happening with her family at home, but she was able to navigate through that by being who she truly was, the true essence of herself when she was working, and carry that back into her family life when she went home.
Nice.
We've all known people like that. I used to take care of a guy. We had him for several months. He kept coming back for small procedures, and you knew he was there because he was entertaining everyone. And I asked him one day, I was getting him ready, starting his IV, and he said, I was like, "How do you do it?" And he said, "You know what? I woke up today. It's going to be a good day."
Right.
And his wife was standing there and she goes, "Don't let him fool you. He's been like this his whole life." He's like, "I have been blessed to be with someone who chose joy every day."
Wow.
And and it showed. I mean, and I thought, well, But what about when bad things are happening to us and when it's really hard? And joy is a choice. We don't have to be happy all the time. We can actually be sad, and it's okay. But to see the joy in every day, that's our gift.
Mhm.
That's our present moment, you know. I don't know why I have to keep learning that over and over, but you know, I think it's the natural ebb and flow of people's lives. But I choose it much more often than I used to. To me, that's a win.
Yeah, I know Dr. Bill Pettit talks about his grandmother, and she had surgery for cancer, and her friends would say, well, don't you worry that you didn't get it all, that might come back. And she said, oh no, that might spoil my day.
Oh, I think there's a few of our phrases in society that one of them that I love is, today's the oldest I've ever been and the youngest I'll ever be. I'm new here. I'm new here. So I'm choosing a new day and see what happens. I can't go back. I can't really go forward. I can make decisions and go in a direction, but enjoy the day.
Well, I
You
think
know,
we have time for one more question. Go ahead, Isabel.
oh, sorry, Lynn, I didn't mean to interrupt you. I heard something in a 3PGC presentation yesterday that has stuck in my mind pretty significantly. You want to know what your future looks like? Check your thoughts today.
That's a good one.
I really enjoyed that one. It's kind of stuck with me for some reason.
Yeah, that's fun.
That's great. That's great. Well, I guess we'll just go ahead and announce when we're going to be back, and that's going to be in December, the first 2 weeks in December. We thought we'd get the jump on the holidays as they come up. We'll be meeting back here on the 6th and then again on the 13th for the Q&A. And we'll be sending out the topic by email, so you have a chance to look at that in advance. And it's going to be totally appropriate for the holiday season. I know I can't remember the words right now, but I know we chose it specifically because so many people feel what they describe as stress around the holiday time, especially. And our goal is to be here with you and help you navigate that. So any closing words, Teresa?
No, thank you for being here with us today, Isabel. Thank you for your great perspective, and we'll see you next time.
Yeah, looking
Thank you.
forward to it. Thanks so much. Have a good day,
Thank you.
everybody. Bye for
You
now.
too. Bye-bye.